And now we have Pamela managed to send us her question by text. This is Pamela from Uganda. She's got an excellent question. She wants to know, with the increase in cases on the African continent, would you say that Africa is prepared to fight this disease, especially in terms of equipment? What do you think needs to be done to get Africa to the position that they need to be in to have a fair chance to fight the disease? It's not... Is this one for you, Dr. Tedros, or is...
I think we've seen the evidence in this pandemic thus far that no one has been quite ready to deal with this disease, and countries in Africa are in no different a situation, and some in a more precarious situation. Having said that, countries in Africa have a long history and a very recent history of dealing with large-scale epidemics. We've seen many countries in Africa deal with large-scale cholera outbreaks over the last couple of years, deal with Lassa fever, deal with measles, deal with meningitis, deal with multiple outbreaks of Ebola. In my more than 25 years responding to outbreaks, I have found African countries, and particularly communities in Africa, to be exceptionally resilient, hugely creative, and capable of mounting responses right from the community level up. Clearly, we need strong governance. We need strong, integrated government leadership. The UN system is fully activated to support countries in Africa in preparation. We have established laboratory diagnostic capacities in every country. We have sent personal protective equipment to nearly every country in Africa. Our country offices are deployed in all countries in Africa and have been there for years, and are working very hard with government authorities on integrated national action plans for response. And again, all countries in Africa have those plans now in place. The challenge is implementing those plans at all levels, from the community right the way through to the head of government. We're seeing strong leadership from heads of government in Africa, but the challenges are great. There are many large countries in Africa with high populations. Africa has become an urban continent over the last 20 years. More than 50% of people in Africa live in cities and increasingly in high-density peri-urban settings. So the challenges are great. We have seen what can happen when infectious diseases can spread very, very quickly in those situations. So there's a huge need to protect populations from infection. There are highly vulnerable populations in many countries. There are large numbers of refugees, which are very kindly hosted by many countries. In fact, Africa has the highest burden of refugees in the world, and African countries host more refugees than any other continent. There are large numbers of vulnerable patients who have HIV or living with HIV and many other challenges. But Africa is strong, and with good leadership, with rapid implementation, we can save lives too. And I have every faith that African leaders are doing everything possible to prepare their countries for this disease and reacting. And the United Nations system and the World Health Organization are there with them to stand and fight.
Yeah, thank you. Thank you. Mike had already said most of it. Just would like to add a few words. With many of countries in Africa, there is alignment between WHO and African countries. One, we're very encouraged to see that many countries are following the whole of government and whole of society approach. And with strong political commitment at the highest level and mobilizing all sectors, because this is not about one sector, or it's not about the health sector, it's about all sectors. And the whole government should act in unison. And that's one. And then on the technical side, we're also very encouraged that many countries in Africa are testing, although they have meager resources. From testing, they're moving into identifying contacts of confirmed cases and at the same time isolating. And this is what we have been proposing and advising many countries. And I hope this will help many countries from Africa to cut the problem from the bud. So that's what we would like to encourage them to continue to do. Political commitment at the highest level and having a political commitment that mobilizes all sectors, and at the same time, from testing to contact tracing and isolating, continue to do what they are doing. And that will really help to suppress and ultimately control the pandemic in the continent. Of course, the number of cases in the African continent is still small, but that doesn't mean that it will continue same way. It may change, but the approach you're using can help in suppressing and controlling it. And what we're saying from WHO side is to continue to do the same, but more aggressively, and more aggressively hoping, expecting that this could get even, the problem could get larger. Thank you.